In Chapter 13, we consider the cultural diversity of California and its impact on 5 policy areas: abortion, LGBT rights, education, higher education, and social programs. Policy conflicts in these areas are struggles among competing groups. Some observers believe that California now faces cultural hyperpluralism, that is, various ethnic, racial, religious, and other groups balancing the ideal of one people with the reality of group identity. Start with social issues. Abortion. In California as elsewhere, the issues of abortion and gay rights mirror a diversity of values and fundamental disagreements over what constitutes personhood and marriage. Here we will focus on 2 of them: abortion and LGBT rights. Abortion. Therapeutic Abortion Act of 1967 clarified abortion practice in California. Allowable reasons to seek abortions included rape and incest, mental health of the mother, and whether the infant would likely be deformed. Coupled with Roe versus Wade, the Roe versus Wade decision a few years later, the number of abortions increased dramatically in California. In 1967, only 518 legal abortions were performed in the state. In 1980, it's 199,089. California law and Roe decision resulted in 2 grassroots movements: the right to terminate a pregnancy versus a right to be born. A majority of Californians have been consistently pro-choice over the past 20 years. The battle over abortion in California is waged on several fronts. First, policymakers and interest groups that influence them, generally overusing Medi-Cal funding for abortions for the poor. In state courts, through protest activity, usually near abortion clinics, though that has waned in recent years. Fought in the court of public opinion, and also at the ballot box. In the face of legislative inaction in California, abortion foes have taken to the initiative process. But voters rejected both Prop 73 in 2005 and Prop 85 in 2006. Both would have required parental notification before a minor could terminate a pregnancy. Let's move to LGBT rights. In this area, the most visible and controversial issue has been same-sex marriage, which is now legal in California. The Domestic Partnership Act of 1999 established a domestic partners registry and granted a limited number of state benefits such as hospital visitation rights and health insurance coverage for partners of public employees. Recent state budgets have included funding to aid LGBT victims of domestic and school violence. In 2011, Governor Brown became the first state governor in the nation to sign legislation requiring school textbooks and history lessons to include the contributions of LGBT Americans. And local governments, a growing number of counties and cities, have passed ordinances barring discrimination against gays and lesbians. Let's move to education, coping with growth and diversity. Public education, K-12, must deal with population growth, ethnic diversity, social change, and variable funding. Education reforms are frequent and they vary in effectiveness. Look at the pressures on education, enrollment growth. In recent decades, the most significant challenge has been the sheer growth of California's school-age population. There's ethnic hyperpluralism. Latinos constitute a slight but growing public school majority, and about a quarter of the state's K-12 students are English learners, meaning that they are not proficient enough in English to succeed academically in mainstream English programs. Social conflict, two-income parents, single parents, child abuse, parental neglect, and poverty have changed the very mission of public schools. Teachers are not only educators, but disciplinarians, surrogate parents, counselors, social workers, detectives, nurses. Also funding challenges. In absolute numbers, California spends far more on education than any other state, but those numbers are less impressive when you consider per pupil spending. California ranks well below other states in spending per student. Let's Turn to higher education. California's master plan for higher education promises affordable access to colleges and universities for all Californians, yet observers wonder if it will be able to handle future demands. Please know for your exam that public education policy is the result of majoritarian politics. A major part of the majoritarian ideal is the Master Plan for Higher Education of 1960, which is considered a world-renowned social compact that articulated a bold vision for the future. It did three things. One, prescribed enrollment parameters for each level. UC campuses would admit students from the top 12.5% of high school seniors. CSU system would admit the top one-third, and community colleges would admit any student capable of benefiting from instruction. Two, the master plan assigned different missions for different levels. This is an important concept to help you study for the exam. UC system would emphasize research, graduate programs, and offer doctoral degrees. CSU system would focus on liberal arts teaching and professional education through the master's degree. Community colleges would provide standard college courses for transfer to four-year institutions, plus vocational and technical training. And three, the plan created a governance structure to operate each sector. In rethinking the plan in current years, policy discussions have focused on three interlocking issues: access, growth, and pricing. One issue that combines access, pricing, and federal-state conflict is higher education for undocumented students. In 2011, after Congress failed to pass a National DREAM Act, California enacted the state's version, which allows undocumented students to qualify for in-state tuition as well as private and state-funded financial aid. California's history of social policy typifies ambivalent benevolence. On one hand, a caring concern for California's truly needy, and on the other, a reluctance to provide handouts. California's array of social programs serve a growing, diverse population, many of whom do not fully participate in the political process. More than 16% of all Californians fall below official poverty guidelines, with the highest rates in the San Joaquin Valley, about 20%. Let's look at welfare policy. For families, you have CalWORKs. California's major program to aid needy families is CalWORKs, which provides time-limited cash assistance to eligible families in times of crisis. In 2011, the maximum monthly cash grant for a family was $638. Recipients must participate in job skills training and various work activities. And also for families, it's a CalFresh, a food stamp program. For children, children benefit from CalWORKs, but also from programs such as Child Protective Services, the CalLearn program, Child Support Enforcement program. Seniors and disabled, a variety of programs assist the elderly and disabled, including in-home supportive services and the state supplemental payment grant program. Let's turn to health policy. Two simple truths govern the politics of healthcare. First, costly medical care does not necessarily equal good health. And second, health services, both public and private, involve a vast transfer of wealth from higher income, healthy people to lower income, less healthy people and those who care for them. Here's some insurance options. Private insurance, Medi-Cal. California's version of the federal Medicaid program for low-income individuals is called Medi-Cal, which began as a federal mandate. Medi-Cal pays for federally required core services, including access to physicians and nurses, hospital care, laboratory tests, home care, and preventive services for children. Funds also are available for optional services such as hospice care, adult dentistry, and chiropractic services. A much less discussed healthcare approach has been the deinstitutionalization of the mentally ill. For your exam purposes, please know that mental health services have failed because of deinstitutionalization, in part because Prop 13 cut revenue for the mental health programs these people needed, and community-based mental health centers never really materialized. Many former mental patients simply became homeless. Please use this lecture as well as other documents as well as other information in your course documents folder to prepare for your weekly quiz. Good luck.